The recording is on, sir. You may proceed, sir.
Okay.
Okay.
Namaste all. With pranams to all my gurus. Let us continue with where we had left yesterday. We had by now discussed about, as I said in the first, about the contents which are being explained in the shloka number 5 and 6 and 7 in the beginning of the chapter, Prakritim cha Pravritim cha. Among them, all the types and all that, we have by now covered, including Sanipata Jwara, the 7 types of Jwara. As we know, it is there in the Nidhanasthana also, Ashta Karana for Jwara. Now we are moving on to Agantuhu Ashtamo Yastu Sa Nirdishtaha Chaturvidaha. Agantu is the 8th Agantu. Agantuja is the 8th type of Jwara, which is being explained Nirdishtaha as 4 types. So which are they? They are Abhighataja, Abhishangaja, Abhicharaja, and Abhishapaja. So what are the reasons for Abhighataja Jwara? Shastra, Loshta, Shaka, Shastra, Loshta, Kasha is Vip. Vip you might have seen in people holding a rope like thing which they bead on themselves, a long rope like which has a thin end. And Kashtha, Mushti, Aratni Tala, and Dvija. Dvija is for teeth. Since we have 2 sets of each, it is Dvija. What is Tadvidhaischa Hate Gatre Jwaraha Syad Abhighatajaha? Because of these injuries, that Jwara which results out of these is called as Abhighataja Jwara. What is the important point here is Tatra Abhighataje Vayuhu Prayo Raktam Pradushayan. The same is being explained in Nidhanasthana also. Tatra Abhighatajena Vayuna Dushta Shonita Adhishthanena. What is the this question, this point is also important for if someone of you is getting ready for entrance. This is also is important. Abhighataja Jwara is caused by dushti of dash. Vayu plus Rakta will be your answer. There comes the question. Chakramani sir clarifies that is there only Rakta dushti? No. The major dushti is in Rakta. Tatha Mamsadinam Manag dushtihi. There is some amount of, there is Alpa Pramana dushti of Mamsadi Dhatu also are mentioned here. Moving on, the other types of Agantuja Jwara are being explained here. Kama Shoka Bhaya Krodhaihi Abhishaktasya yo naraha yo jwaraha. So Abhishangajo Abhishanga Jwaro Gneyo Yahacha Bhuta Abhishangaja. So what happens here in this Abhishangaja Jwara? It is said as by the involvement of Vata happens when there is Kama, Shoka and Bhaya. Pitta gets involved when the Jwara is because of Krodha. For Bhuta Abhishanga, Trayo Malaha Kupyanti. When there is Bhuta Abhishanga, all the 3 mala become affected. So what is this Bhuta Adhikara? What is this Bhuta Abhishanga? That we get the reference in the Unmada Chikitsa. If you can turn on to that part of Unmada, there is a reference of Agantuja Unmada, Bhuta Abhishangaja or Agantuja Unmada. In that we get the reference about these Ashtavidha and their Lakshana. Next is Abhishangaja can also happen, Vishavruksha, Anilasparsha, all these things can also end up in causing this. So what you have to give treatment? Chikitsaya Vishagnai. One has to treat this kind of Jwara using Vishagna Dravya. Next is Abhichara and Abhishapaja. What is the role of dosha in this Abhicharaja and Abhishapaja? It this these two Abhichara and Abhishapa Siddhanam Yah Pravartate. There comes the question: who is a Siddha or what is Siddha? If you can go to the Tika, the last but one line, Siddha Mantra Aushadha Tapa Shamadhi Siddha. One who is very much used to, very much uh, proficient in mantra, aushadha, tapa. All these are called as, who is very good in all these is called as a siddha. Moving on, what is the dosha involvement in these two? It is, remember, it is sannipataja jwara. In abhighataja, it is vata and rakta. In abhishangaja, depending upon the cause, it may be vataja, it may be pittaja, or it may be tridoshaja. Abhishara, abhishapa are sannipadaja and they are ghora. सन्निपात ज्वरस्योक्तं लिंगम यत्तस्य तत्स्मृतं जितेन्द्रिय शरीराणाम. All these are explained. Now comes the question: how do you diagnose these types of fever? There, the next point is the next shloka is the answer. Prayogam tu abhicharasya drishtva shapasya chaivahi. One must have seen the prayoga of these, or by his own experiences, by anumana, or by the upyoga of proper drugs which are counteracting these conditions, prashamenava. By all these four ways, see, that this condition or this context does not only say about this is the disease, this is this, but it also says about the diagnosis. How do you diagnose this? And there comes the next question: what are its clinical features? There comes the answer: Vaividhyad abhicharasya shapasya cha tad atmake. Since it differs from person to person, the what abhichara or what shapa is been there, hence it is pruthagvidham. They are different for each type of fever. As in, they are different for Kama Jwara, they are different for Shoka Jwara, they are different for Krodha Jwara, they are different for Bhutavesha Jwara, they are different for Vishasambhava Jwara. Then comes the question: will the Jwara Lakshana come first, or will the Lakshana of the particular cause comes first? Keshat Dosha Desham, sorry, Keshanchid Desham Linganam Santapo Jayate Puraha. Pura is at first, Santapo Jayate. At times or at conditions, at different conditions, it may be the clinical features depending on the type of the Jwara, those may be prominent. Next comes the point of involvement of Manas here. Involvement of Manas and involvement of Sharirika Dosha. You can see in the next sloka, Manasya abhihate purvam kamadhyehi na tatha balam. What happens here is there is involvement of multiple factors. So there comes the question: will the Jwara be more prominent, or the other Lakshana of typical Lakshana of that particular Avesha or Visha or Bhutavesha, Krodha, Shoka, Kama will be more prominent? So there again there is answer by the Guru in Kamaja Jwara or in Krodhaja Shokaja Jwara. At all these conditions, more of Manas is involved. So when will Jwara becomes more? Jwara prapnoti vatadyehi deho yavanna doshyati. So Jwara will gain momentum, Jwara will become more prominent when the Vatadi dosha, Vatadi Sharirika dosha, Vatadi Daihika dosha become involved. And also, Jwara gains momentum when there is more involvement of Manas also. Then comes the question. There is one point here in the Thika saying that in Nidanasthana, the Abhishangaja Jwara is said to be caused by Vata and Pitta. If you can, as I said then, if you can go back to the Nidanasthana first chapter, you can see the shloka number 30. Tatra abhigatajo vayuna dushta shonita adhishthānena abhishangajaha punaha vata pittabhyam. But whereas here it was said to be as kamashokadbhayad vayu krodhat pittam trayo malaha. So what is the explanation given here? But here it is said as tridoshaja also. There comes the question. In Nidanasthana only the Kamadi Jwara, different types of Abhishanga were explained then. But whereas Bhuta Abhishanga is being explained here, this Bhuta Abhishanga is certainly Tridoshaja. That is what is being explained here. Then comes a point saying that if you have read somewhere that there is explanation which we get in different contexts, where Chakrapani sir says Kashmiraha, which we get the reference of saying there is another version of Charaka Samhita there, wherein few additional points are there, or few points may be lesser there. Moving on to the next point, te purvam kevalaha paschat nijaihi vyamishra lakshanaha. What is the speciality here is at times they will be kevala agantuja. At times they become one, or they become similar to a nijajwara. So what is the explanation given here is agantuja jwara te purvam. Purvam means in the beginning. Kevala iti nija dosha rahitaha. So here the word kevala means, they are separate. They are not everything, or they are not on a broader sense. Te purvam kevalaha. Here kevala means they are just on their own. They are not with anything else. But paschat, later, nijaihi vyamishra lakshanaha. As days progress or as time progress due to kala, they become involved, they become mixed up with the sharirika dosha, and vyamishra lakshanas are seen. Both Agantuja Lakshana, Jwara Lakshana, as well as Nija Jwara Lakshana are seen as time progresses. So, what is the speciality? What is the Vishesha in Agantuja Jwara? Is Hetu as well as Aushadha. Because the Hetu is special here. Hetu is not what we generally talk of. The dosha is not seen here. The Hetu, what we generally see about the Aharaja, Viharaja, Nidana, are not commonly seen here. So, what is seen here is the four types of Agantu Nidana. It is also important to note that the Aushadha is also different here, wherein in the last line you can say Tatra Vishishto Hetuhu Abhighatadi Bheshajam cha Parisheka Mantradi. Treatment is different, Nidana is also different. Hence, hence Aganta Jwara are explained in a separate way here. Moving on, now comes the very important shloka. Samsrishtaha sannipatitaha pratagva kupitamalaha Jwara Samprapti. Even here in Jwara Samprapti, you can see in the fourth line, Srotamsi Rudhva Sampraptaha Kevalam Dehamulbanaha. Even in the last shloka, Te Purvam Kevalaha, we heard one Kevala word, we saw one Kevala word, and we are seeing one more Kevala word here. This is um, purely contextual, wherein based on the context, the meaning differs. You might have heard of the the phrase of Saindhavam Anaya. Saindhava means a horse, Saindhava means also Saindhava Lavana. So if it is a war time, if someone tells Saindhavam Anaya, bring Saindhava, one should not go and give salt. One should go and give a horse. One should take a horse with him. Whereas when you are on a dining table, when you are having food, if someone asks Saindhava Manaya, one should not take a horse. One should take the salt. The same way here, Kevala differs in its meaning. In the Samprapti Shloka, the word Kevala means the whole body. Whereas in the previous shloka of Agantuja Jwara, the word Kevala means only. Only Kevala, only Agantuja, or with that which is Nija Dosha Rahita. Samsrishtaha Sannipatitaha Pratagvakupita Malaha. This Samprapti goes hand in hand with the Samprapti which is explained in each Doshaja Jwara in Nidanastha. Rasakyam Dahatum Anvetya Paktim Sthanat Nirasya cha Svena Tena Ushmana Chaiva Krutva Dehoshmano Balam. There is increase in the Ushmana, there is increase in the Ushmata of the Deha. Srotam Sirudhva Sampraptaha Kevalam Dehamulbanaha Santapam Adhikam Dehe Janayanti Narastadaha. Why does the Santapa becomes Adhika? Because it is Svena Ushmana, Tena Ushmana, body's own heat, as well as the Agni's heat from the Paktisthana. They both have joined together, they both have combined to cause Santapam Adhikam. Janayati Narastada Bhavanti Ushna Sarvango Jwaritastena Cha Uchyate. Jwarita is a patient suffering from Jwara. Jwaritastena cha uchyate. What is the definition for a person who is suffering from Jwara? Bhavati Ushna Sarvanga. Whom do you have to call as a person with Jwara? How do you diagnose? How you should diagnose a case of Jwara is by Ushna Sarvanga. Person has to have Adhika Santapa in terms of Ushna Sarvanga. Increased Ushnata in Sarvanga. Down in the Tika, we get interesting points here. The definition for Samsrishta and Sannipata we get here. As the shloka starts with Samsrishtaha Sannipatitaha, we get here the explanation. Samsrishta iti yugma bhutaha. Yugma is combination of two. Samsrishta is combination of two. Sannipatita iti trayo api militaha. Sannipatita, what combination you call it as Sannipata is Trayo Api. All three are combined, then it is called as Sannipata. Sthanad iti paktimiti pakti hetutaya jataragnim brute. So what do you consider here as pakti? What does pakti mean? Paktim sthanan nirasya cha, paktim sthanat nirasya cha. The word paktim means jataragni. Sthanat iti grahanyah. Grahani hi jataragni sthanam. So what is Grahani? Grahani is the place where Jataragni is situated. Do you remember any other context where we get a similar shloka? Let's quickly go to Chikitsam 15th chapter. The earlier shlokas, the very first shloka, we find the explanation of Grahanim Ashrito Agni Dosho Grahani Doshaha, which you can understand. Grahanim Ashrito Agnihi, or Agni is Ashrita in Grahani. So similar way, we also have this reference here. Grahani hi, Grahani is the only, Grahani is the Jataragni Sthana. This is the Grahani is ashrita, gets ashraya in the, sorry, Agni gets ashraya in the Grahani. Svena iti dehoshmana, tene iti jatragni ushmana. Svena tena ushmana. This is what I said then. Svena ushmana and tena ushmana. Both combine, the dehoshmana and the jatragni ushmana combine to increase the santapam adhikam. So which results in the causation of bhavati atyushna sarvango. That results in formation of increase in ushnata. There comes the question, how can vata kapha result in increase in jwara? Dehoshmana iti sakala dehacharinaha prakritoshmanaha. Moving on, vata shleshmanoho tu yadyapi pittavadushma nasti tathapi tayor bhutatvena ushmayo asti sa iha grahyaha, which continues as bhaumya, apya, agneya, vayavya, panchoshmana and all that. So what we have to understand here is, even though pitta is not prominently present in vata kapha jwara, but one has to remember that the panchamahabhuta which are present in vata and kapha, they have their own mahabhuta agni. As we know the shloka bhaumya, apya, agneya, vayavya in the 15th chapter, those agni are responsible for the formation of santapa adhika here. But one has to also remember sarvatra hi jware pittam avashyam bhavati. One has to remember that pitta is responsible. Pitta is the most important factor in the production of fever, in the production of jwara. It continues as ushma pittadrate nasti jwaro nasti ushmana vina. So there is no ushmata, no jwara without pitta. As I said, then what is kevala here? Kevalam iti samastam. Kevalam means everything. Moving on, srotasam sanniruddhatvat svedam na adhigacchati. After the samprapti, we move on to stages of different stages of jwara. Swasthanat pratyute cha agnau prayashah tarune jware. So what causes absence of sveda here in taruna jwara is number one, srotasam sannirodhatvat. Point number two, swasthanat pratyute cha agnau. These are the two factors which result in absent sweating in case of taruna jwara. But in Thika, Chakrapati sir also explains that it is not true in all. Prayaha iti yojyam. Prayashaha. What does the word prayashaha? That means in other type of jwara, in quite other type of jwara, there may be sveda agamana. There may be sweating may also be present. Moving on, the next one is amajwara. Aruchihi avipakascha gurutvam udarasya cha hridayasya avishuddhihi cha. This is one unique feature what we find in amajwara, which can be understood in different ways. If you consider hridaya as manas, then you can consider it as unclear mind or thoughts and all that. If you consider it as the hridaya proper as an anatomical part, then one can understand it as an uneasy feeling in the chest region. Tandra alasya jwaro avisargi. Jwara does not come down easily. Jwara is balavan. Also doshanam apravartanam. So what does doshanam here mean? Doshanam iti mala sambadhanam doshanam. Lala praseka hrillasa kshunnasha virasammukham स्तब्ध सुप्त गुरुत्वम च गात्राणाम बहुमूत्रता. Remember, amajwara, bahumutrata is an important clinical feature. Na vit jirna न च ग्लानिर्ज्वरस्य आमस्य लक्षणम्. What does the word meaning here? Na vidjirneti na purisham pakvam. Na purisham pakvam, na pakvam purisham means ama purisha. Person excretes ama purisha. Na cha glanihi iti na kshina mamsata. Remember, so we can understand that in Amajajvara there is no much of Mamsakshaya, there is no much of Glani. So one has to understand here, like additional information, what we have to understand is Nacha Glanihi iti na kshina mamsata. That means what we have to understand, in Glani there will be Mamsakshaya. Moving on, Pachyamana Jwara Lakshana, Jwara Vego Adhikaha Trishna Adhikaha Pralapa Shwasana Shwasa Brahma. There was no Malapravritti. Here Malapravritti and Utklesha, they both happen. That is what is the clinical feature in Pachyamana Jwara. Moving on, Nirama Jwara Lakshana Kshamatva Lagutvam Cha Gatranam Jwaramardavam Dosha Pravrittihi Ashtaho Nirama Jwara Lakshanam. From here on, one more important context of Doshapaka come. Because the amata is getting reduced and we are getting the nirama stage. So what is this nirama stage? We can also consider it as the doshapaka avastha. Atra cha kshudadayo doshapakad bhavanto. You can get this term of doshapaka here. What is the important here is the clinical features and the reference of Ashtaha. Ashtaha is by 8th day. 8 days. Ashtahastu Kshudadin Vina Doshapake Bheshaja Danayogyam Jwarasya Vyadehe Niramatam Brute. Even after 8 days, if the person does not get to have the Doshapaka Lakshana, then the person has to be given medicine. Hope we all remember that one has to undergo Langana and is not supposed to be on any medications until the Doshapaka avastha are seen. Hope you remember this. So based on this, until one attains the Doshapaka avastha, one should not be administered with any medicines. He should be on Langana. Then comes the question, what medicines needs to be administered after the 8th day or after the stipulated time period? Ata eva pachanam shamaniyam va kashayam payayetutam. Remember, it is advised only after the 8th day or only after the doshapaka lakshana are seen. Then comes the point of pachaniya aushada and shamaniya aushada. See, there are two explanations here. What medicine to be given? You can give either Pachaniya or you can give either Shamaniya. Whom to give Pachaniya? Whom to give Shamaniya? See, there are two situations here. By 8th day, if the person has attained Kshut Kshamata Lagutva and all that and has become Nirama, then the patient has to be given with Shamaniya Aushadhi. But the patient has come to the 8th day, but still Ama Lakshanas are seen, then one has to be administered with Pachaniya Kashaya. I hope you are getting the point. You can see in the next line itself. Yada Ashtahe Shudadi Doshapaka Lakshana and all that is there. Doshapakartham Pachaniyam Deyam. If the lakshanas are not seen by 8th day, then dosha pakartha pachaniyam deyam. Jataha tada kshudhadi lakshana jataha shamaniyam deyam. Then, if the lakshanas are seen, then shamaniya kashaya should be given. Now comes the question, when to consider a jwara as nirama jwara? There comes the explanation of Karanada. Karanada says that these can be considered as criteria for diagnosis of Nirama Jwara. What is that? One is passage of 7 days. I mean to say the patient has entered the 8th day. Or there is utpatti of kshut kshamata lagutvam chagazaranam jvaramardhanam and all that. If these two are seen, either of these two are seen, then the person has to be considered with Niramajwara. But there comes the question that can the same be explained, can the same be understood in case of Sannipata Jwara? There comes the question. But Karnada sir continues his explanation and says, Chiradapi hi pachyante Sannipata Jware malaha. In case of Sannipata Jwara, the pachana, the doshapaka does not happen according to this rule. There, the paka happens late. Chirat is late. It becomes a bit late. So what has to do in those conditions? In those conditions, since the 7th day has passed, one has to consider that has entered the stage of Niramata, and if the Lakshanas are not seen, then go with Pachaniya Kashaya. If the Lakshanas are seen, then go with Shamaniya Kashaya. And there comes the question, if someone gets a patient who is already having Doshapaka Lakshana but he has not yet entered 8th day, what to do? There is explanation in Sushruta Sir's textbook who says, Arvagapi chadeyam syad bheshajam doshapakataha. Even though the 8th day has not appeared, in the patient's kala is not there, but the doshapaka lakshanas are seen, then go with the medicine. Bheshajam deyam. Remember, bhesaja is not indicated in Amajwara. Then comes the question, what are the contraindications in this type of jwara in Navajwara? Navajware दिवा स्वप्न स्नान अभ्यंग अन्न मैथुनम क्रोध प्रवात व्यायामान कषायांश्च विवर्जयेत. So all these are contraindicated in cases of Navajwara. Anna shabdena gurvannam abhidatte. Why Gurvanna is contraindicated? You can see in the lower down below the line. Gurvanna bhojanam chapi vishtambhi dosha kopanam. What is the effect of Guru Anna? What is the effect of Guru Ahara Sevana? It is vishtambhi as well as it is dosha kopi. Moving on, haritena hi navajvare vyavayadi pratyekam dosha kopanam. Why it is contraindicated? It is dosha kopana guruvarna bhojana chapi vishtambo dosha kopanam. The same thing is being explained. Then comes why kashaya is said to be as vivarjayet, because kashaya rasa guru ushna snigdha and all are being contraindicated in these conditions. Jware. So then what is to be done in Jwara? Jware langhanam evadav upadishtamrute jwarat. So what is indicated? It is indicated. What is indicated in Jwara? In Jwara, Langana is indicated. Langhana shabdena anashanam vivakshiptam. So what is Langhana? Langhana here is in terms of anashana only. Lower down you can see there are dashavidham eva langhanam muktam. There are 10 types of Langhana said in Langhana Brahmaniya chapter. And also Chatushprakara Samshuddhi are being explained as Langhana. So do we have to consider all of them as Langhana here? What is Jware Langhanam means? Langhana Shabdena Anashanam Vivakshiptam. Only Anashana should be considered as Langhana here and not all other different types of Langhana should be considered. You can see in the lower down it is said Navajvare Anashana Rupa Langhana Apekshaya Parishesha Langhana Pratishedham. Other Langhana or Parishedha Langhanam Nishid Samshodhanadi Rupam Langhanam Nishidhyate. Samshodhanadi and other types of Langhana are all contraindicated. What is indicated? Navajware Anashana Rupa Langhana is only indicated. And depending on the situation, depending on the condition, tena avasthayam vamanam api bhavati vakshamanam. So based on avastha, based on the condition, even one can be administered with vamana also. Then comes the question, when one has to give pachana dravya and all that. Pachana dravya should be administered at first. Remember, but it is only before Aushadha Prayoga and not at the Navajwara Avastha. As I said in the previous point, Pachana or Shamaniya Kashaya are indicated. When is Pachaniya Kashaya indicated? It is when the Kshut Kshamadi Lakshana are not observed. The same thing is being explained here. Pachanaihi tan bhishak pragnaha and all that. So one has to remember that Pachana Aushadha should not be given rather in the Navajwara stages. It is important. And as I said, Kapha Pradhana Nityadi Vakshamana Avasthayam Gneyam and all that is explained here, wherein Vamana is indicated. Here comes the question, what is this Kshaya Shabda which is being explained in the Tika? Kshaya Shabdena Dhatu Kshaya Kritam Jwaram Kimva Rajayakshma Jwaram Grunhati. So what is Kshaya Anila Bhaya? What is this Kshaya? Is this Dhatu Kshaya? Then comes the question of Vayu, ending up this as we Vayoho Dhatu Kshayat Kopo is being explained in the 28th chapter. Yastu Marga Avaranena Vayuhu Kupyati Sa Avaraka Dharmitaya Prayena Samo Bhavati Tatra Cha Langhanam Matraya Kartavyameva Same Vate Api Langhanam. Remember this. Whereas others also, even though other conditions are said to be devoid of anila, कालांतरेण वात संबंधो भवति कामादि ज्वराभिधानं तेषु कालांतरेण वात संबंधो भवति. So in the other types of jwara of bhaya, krodha, kama, shoka, shrama and all that, langana is not indicated. Moving on, what are the effects of langana? Why one has to undergo langana? Langhanena kshayam nite. So what undergoes kshaya? Number one, dosha. Number two, sandhukshite anale. Anala is synonym of agni. So dosha kshaya happens, agni sandhukshana happens, vijwaratvam. There is, we understood in the previous shlokas that what is this jwara? Bhavati ushna ati ushna sarvanga jwaritastena cha uchyate. So what happens? Because of langana there is vijwaratva, laghutva, sharira laghutva, deha laghutva, kshut. All these things are, all these things become prominent. These are the effects of Langhana. Prana avirodhina chainam langhanena upapadayet baladhishthanam arogyam yadartho ayam kriyakramaha. Remember always, when you do treatment, always keep bala in mind. That is what Sir says here. One has to keep in mind the bala. Why? Because arogya itself is dependent on bala and all should work towards it. And when a person is administered with langana, it should not be bala avirodhi. Prana avirodhine iti bala avirodhina virodascha atikshaya karatvena iha uchyate. Because one should not end up in causing ati pramana kshaya. Then comes a very interesting point of dosha paka, dosha pachana. So how can one cause dosha pachana? Langhanam svedanam kalo yavagvah tiktakorasah pachanani avipakvanam doshanam tarune jware. How do you do pachana of dosha in taruna jwara? Is by all these different ways. So what is the word mentioning of kala here means? The word kala here means 8 days. We have seen it in the previous shloka also. 8 days is the time required for dosha pachana to happen. What is the meaning of the word tiktakarasa here? One is not supposed to take the yavagu as such. Tiktako atra yavagu paniyadi samskaratvena gneyaha. The one which has been samskara used, the tiktaka rasa is dravya which is used for samskara in yavagu. Whereas remember, you are not supposed to give any tikta dravya directly in case of jwara, directly in case of taruna jwara. So what one can do is add them along with yavagu. Bheshajam hi amadoshasya bhuyo jvalayati jwaram. What happens when bheshaja is given? It might increase the jwara. This is why one has to be careful while treating taruna jwara. Then comes the question, tena ashtahad urdhvam अतरुणे ज्वरे अपक्वेषु दोषेषु प्राधान्येन कषायपानं पाचनम् अधिकृतं न लङ्घनादया इति दर्शयति. So how long you are supposed to give langhana? As we all know, langhana is the first thing you have to do in jwara. But how long you are supposed to do it jwara? You are supposed to do it for 8 days. After 8 days, even though dosha are found to be having a pakva stage, then one has to think of giving pachana aushada. Pachanani avipakvanam doshanam tarune jware. How do you bring out dosha paka in taruna jwara? Is by langanam svedanam kalo yavagvas tiktako rasaha and all this.
Sir, here Swedana can be given before 8 days only, sir. Is that what it means?
Sorry?
Swedana when to give, sir? Before 8 days only can we give, sir? Is there any for the arrangement of that shloka? Is there any order, sir?
No, no, no. It is not like order. These are the ways of bringing out dosha pachana.
Okay, then the Swedana should be given after 8 days, sir.
No, these are the ways to bring out dosha pachana. 8 days is also a time period for dosha to become pakva.
Okay, sir.
See, this does not mean that langana is to be given before 8 days or after 8 days. That is not said here, right? The same way, these are the ways. How do you bring out dosha paka? Is by giving langana, is by giving svedana, is by maintaining the same situation for 8 days, or you are waiting for 8 days, or giving yavagu again in the coming shloka you will find manda peya vilepi yavagu, different manda peya yavagu, these three come in the next, which one to be given at first and all that. Along with that, pachana aushada has to be given. These are the different ways you can bring out dosha paka.
Okay, sir. Thank you.
Okay. So next comes the question, what has to be given along with this? What is uh, the jala which is supposed to be used here? Is it we are supposed to use Ushna Jwara, or we are supposed to use Shita Jala, is what is being explained. Trushyate Salilam Cha Ushnam Dadyat Vata Kafajware. If you are dealing with a condition of Vata Kafajwara, then one has to use Ushna Jala. Madhyothe Paithike, one has to use the Shita Jala. Here the word Shita Jala does not mean the typical cold water, but it means Shruta Shita Jala, because it is Tiktakaihi Shrutam, which is being samskarita with Tikta Dravya, that is supposed to be used here. Why are these used? Ubhayam hitat Jwaragnam. These both are Jwaragna. These both are Deepana. These both are Pachana. Remember, we are not talking of a Shita Jala as such. We are talking of Shruta Shita Jala, which has been Samskarita with Tiktarasa Dravya. Where is this Tiktarasa Dravya Shruta Shita Jala indicated? It is in Madhyotta and Paithika. Where is it indicated? Ushna Jala, it is in Vataja and Kafaja Jwara. So, what is the utility of, what is the use of these two? It is Deepana, Pachana, Jwaragna, Sroto, Shodana, Balya, Ruchi, and Svedakara. Is also said as Shivam. So, what does the word Vata Kapha Jwara here means? What do we understand commonly is when there is combination of Vataja and Kafaja Jwara is what we commonly understand. But Chakrapani sir clarifies this saying Vata Kapha Jwara iti Vata Jware Kapha Jware Vata Kapha Jware. Where is Ushna Jala indicated? Ushna Jala is indicated in these three Jwara, these three types of Jwara, Vata Jwara, Kapha Jwara and Vata Kapha Jwara. So does that mean in all other conditions you have to use Shitala Jala? It is not so. Tikta Kaihi Shrutam. So what is this Tiktaka Dravya mean? Tikta Kaihi Shrutam iti Vakshamana Mustadibihi. If you go to the next sloka, this is almost everyone's favorite sloka. Mustaparpata Kaushira Chandana Udiche Nagara. These are the Dravya which are Tikta. So what you have to do in case of Madhyotta and Kapha, I mean Madhyotta and Pitta Pradhana Jwara, you have to use, one has to use Tiktaka Dravya, which is these. Shruta Shita Jala of these. Ubhayamiti Ushnam Tatha Tikta Shruta Shitam. These drugs added with, that is what is Shruta Shita. There comes the question, what to be used in case of Sannipata Jwara or in any other type of Jwara, which is the one which is commonly indicated. You can see the explanation of in Kinnu Kalu Jwaritebhyah Paniyam Ushnam Prayachanti. This is one important big Gadhya which is there in the third chapter, the I think the 40th shloka in Vimanasthana, which says where we are supposed to use Ushna Jala, where we are supposed to use Shita Jala, all that reference we find there. So when you don't have a reference of which Jala to be used, you are always supposed to use Ushna Jala. That also reference we have in the coming shloka. I'll tell you in the particular context. Moving on, the next, as I said, favorite to all is the Mustavar Patakaushira Chandanaudicya Nagarehi Shrutashitam Jalam Dadya Pipasa Jwarashantaye. If one is very fond of Draviguna, he will stand out and say, sir, the Shunti is not Tikta, right? So where is the use of the word Shadanga Paniya? Musta Ityadihi Paniya Sadhakaha Shadanga Prayogaha. So these are the Shadanga, which is Paniya Sadhaka. In this form, we are giving it. Atra Shunti Atikta Api. Even though it is considered as not Tikta Rasa Pradhana, it is not Tikta. Remember, all others are Tikta Pradhana. That means all others are Tikta. Amashaya Dushti Karaka Jwara Hitatvat Vihita. It is included here so as to make the Jwara, which is Amashaya, make the person free from Jwara, which is Amashaya Samutha. Nowadays, we also find Shunti Rahita Shadanga Paniya, wherein if a person, if a doctor finds it is to be where it is more of Pitta Pradhana, where one should not use Shunti and all that, one can find a Shunti Rahita also. The only 5 combination is also available. So then comes the question, okay, sir, you said these are the 6 dravya to be used. How much to use? What is the quantity of water to be used? As I said many times, Chakrapani sir is very student friendly. He is very practitioner friendly. So he makes it things very clear. How much to use or how to use. Yad apsu shruta shita su. Remember, Shadangapanya is always to be used shruta shita. It is not to be used hot. It is always boiled, cooled, and then used. Yad apsu shruta shita su shadangadi prayujyate karshamatram tato dravyam. So, what is the quantity of the dravya to be used? The combination of 6 is to be used is 1 karsha. 1 karsha is about 12 grams. Sadhayet prasthike ambhasi. Ambha is jala, prastha jala. So what is the quantity of water to be used? It is 3 odd liters of water with 12 grams of dravya. Ardhashratam prayoktavyam pane peyadi samvidhau. Boiled, it should be shrutam is boiled and reduced to half. Ardhashratam prayoktavyam. Where it can be used? It can be used for pana, or it can be used for peyadi samvidho. That means it can be used for preparation of peya and other food articles or other items for the patient. Kapha pradhana nanutklishtan doshanam आमाशय स्थितान बुद्ध्वा ज्वरकरान काले वम्यानां वमनैहि हरेत. See, these are the different phases or different conditions within Jwara, where different the same line of treatment or the same Shadangapanya might not be useful, or as the previously said, Langana might not be enough, or Pachaniya Dravya Kashaya may not be enough. So, what is the condition where Vamya or Vamana is indicated is Kapha Pradhana Utklishta Dosha Avastha, number one. The other one is Dosha Amashaya Sthita. If you can go back to the Samprapti Shloka, what is the condition here in what is the condition here of the dosha? It is kevalam kevalam. It is present all over the sharira. The dosha will not be present in only one particular area, whereas here it is, if the dosha is amashaya sthita and it is in kapha pradhana avastha and utklishta, and when the vamana is to be given, or when the vamana is to be administered is Jwarakara Kala. One has to wait for the Jwarakara Kala, use Vamya Dravya, or make sure the person is Vamana Arha, and in that person the dosha needs to be Nirharana through Vamana. So there comes the question, how do you understand Utklishta Avastha of Kapha or Utklishta Avastha of Dosha? You can see in the Tika, Utklishtan iti Hrullasa Adina Bahir Gamanon Mukhan. So that is a condition where you find Hrullasa in a patient. Amashaya Sthitani iti anena sarvashariram parityajyam amashaya gamanam darshayati. As I said, the dosha are not in sarva sharira, whereas they have got themselves confined to amashaya. Moving on, vamyanam ityanena avamya garbhini adishu vamanam nishedhayati. Here comes the question of, do you have to give all sneha sweda and all that for these patients? So why do we commonly do sneha svedana in patients is for this utklishta to happen, right? Sneha sveda are required to make the dosha utklishta and come to either ramashaya, pakvashaya, and we do shodhana. But here the dosha themselves, they are in the stage of utklishta avastha. So here there is no need of giving snehana and svedana, when the person can be directly administered with the vamana dravya. Anupasthita doshanam vamanam tarune jware hridrogam shvasamanaham moham cha janayet bhusham. So what happens if you give, or if the person is administered with vamana in case of taruna jwara, In case of anupasthita dosha, as said in the previous one, there is no utklishtata of dosha, there is no amashaya sthitatva of dosha. In that condition, if one administers vamana, it can end up in janayet bhrusham. It can soon end up in hridroga, shwasa, anaha, and moha. So, what is the condition of dosha which is not supposed to be nirharana, which is not supposed to undergo nirharana? Are sarvadehanugaha sama. If the dosha is sarvadehanuga, if the dosha is sama, if the dosha is dhatustha, they are anirharaha. They are not supposed to be removed. Doshaha. So what happens if you remove a dosha which is sama? If you try to remove a dosha which is dhatustha, if you remove a dosha which is sarvadehanuga, doshaha falanam amanam swarasa iva satyayaha. Satyaya, the word satyaya means, you can see in the last line of Tika, satyaya iti savyapadaha. It will end up in complications like hridroga, shwasa, and etc. Doshaha falanam. It is similar to, you want to extract juice out of ama phala, unripe fruit. What happens here? When you try to do extract juice, the phala gets destroyed, and also you don't get the juice. The same way, when you try to do nirharana in case of sarvadehanuga dosha, in case of sama dosha, in case of dhatusta dosha, it will end up in satyaya. It will end up in savyapat. These are the conditions where we need the purva karma and all that. Whereas in case of utklishta dosha, in case of amashaya sthita dosha, vamana can be administered directly. Sarvadehanuga iti sukshma sira anugataha, that which is into the sukshma sira. Sama iti samatvena styana aprachalascha. See, dosha are usually sarvadehanuchari. They keep on moving. We all know that. But whereas when I say the dosha is sama, that means it is styana. Styana means that which is styana, aprachala. They go hand in hand in their meaning. The word styana may be considered as something which is slow. Aprachala, that which is not moving. Dhatustha iti dhatushu atyanta anupravesha vyavasthitaha. That they are literally something which is into the dhatu, which is adhered into the dhatu, is what is the meaning here. Next comes the word asunirharaha. The word asunirharaha is na sukhena nirhiyante iti asunirharaha, or it also means asun pranan nirharanti iti asunirharaha. So that which is not easily nirharana, which does not undergo easy nirharana, is what is asunirhara. And the word asunirhara also means that pranan nirharanti. We can understand it in two different meanings, which both meanings can be contextual at this point. Moving on, so now we understood that this is what to be given in case of the person who is in Tarunavastha, the Jwaraa is in Tarunavastha. If it is Utklishtavastha, if the person is administered with Shodhana or Vamana in Anupasthita dosha, what are the things which happen? So now comes the question, what to be done next? If the person is given Vamana, Vamitam Langhitam Kale, Yavaghubihi Upacharet, Yatha Swaushadha Siddham Manda Purvabhiraditaha. Remember, at first, Manda is to be given. Yavajwara mrudu bhavat shadaham va vichakshanaha tatsya agni deeptate tabihi samidbhiriva pavakaha. So what happens when you give Manda to these patients is Agni Deepana happens. How does the Agni Deepana happens? There is a simile explained here. Samit, similar to Pavaka, similar to Agni being given with Samit, how it it flames up. Similarly, Agni also flames up. Agni also becomes increased. So what is the effect of this? वातमूत्रपुरीषाणां दोषाणां च अनुलोमनाः स्वेदनाय द्रव उष्णत्वात् द्रवत्वात् त्रुट्प्रशान्तये आहारभावात् प्राणाय सरत्वात् लाघवाय च ज्वरग्नो ज्वरसात्म्यत्वात् तस्मात् पेयाभिराधितः. What is the effect of giving, or what is the use of giving peyadi here is they end up causing anulomana of vata, mutra, purisha along with dosha. They cause svedana. Why? How does that cause vedana? Because they are drava and ushna guna pradhana. They cause trishna prashamana because of its drava guna. Ahara bhavat pranaya. They protect prana because they have qualities of ahara. They bring about laghavata in sharira because of its saraguna. They are jwaragna. They are they because of all these points they bring down, they bring a relief from jwara. Then comes the question, can this peyadi be given in all conditions? Jwaran upachare dhiman rute madhya samuthitam. In case of madhyajanya jwara, मदात्ये मध्यनित्ये ग्रीष्मे पित्तकफादिके ऊर्ध्वगे रक्तपित्ते च यवागुर्न हिताज्वरे. In these specific conditions, yavagu is not indicated. So there comes the explanation of uh, when is this to be administered. Then vamitam langhitam iti avasthavashat kadachit vamitam kadachit langhitam kadachit cha vamita langhitam. So this can be administered in patients who have undergone vamana. This can be administered in patients who have undergone langhana also. When it is to be given in the kala is anna kala. So what is to be given here? Aushadha siddha. So what is this aushadha siddha manda? This aushadha we can understand in two ways. A few shloka ago we learnt about the musta parpata and all that. That can also be considered here. Or down below in the tika we have यथासु औषध सिद्धाभिरिति यथा विषयं यस्यां यवाग्वां यद् भेषजं पिप्पली नागरादि वक्तव्यम्. So the drugs which are explained, they are supposed to be used. यस्मिन् ज्वरे यद् भेषजं पाचनं वक्तव्यम्. So the dravya depends upon the jwara. So the same thing, Sushruta sir also explains, Annakale hita peya yathaswam pachanaihi yukta. So one has to give peya which is added with pachana dravya. Manda purvabhiriti manda pradhanabhihi. Tatra prathamam mandam pitva tad tanupeya bhago yojyaha. Remember, one has to give manda at first, then peya is. We know the ratio of the liquid and solid in all these, right? Manda, the only liquid one. Peya is got more solid. Yavago is mostly solid, right? So it is more becomes more guru. So which is to be given first in case of jwara, in case of person who has underwent langana, or person who has underwent vamana, or person who is suffering from jwara is always the laghu pradhana dravya, right? So manda is indicated at first. Then comes when has to give yavago is only when the tivrata of jwara comes down. Then the tika continues with the explanation about the contraindications of the jwara, sorry, I mean the contraindications for this peya or the contraindications for this yavago. What happens when it is given? is there is explanation of Pamshudhane yatha vrishtihi kledayatyati kardamam tada shleshmani samvruddhe yavaguhu shleshmavardhini. Remember, yavagu is shleshmavardhaka. So if in case of shleshmala pradhana kapha pradhana jwara, if one administers yavagu, it becomes more complicated. It becomes shleshmani samvrud. It becomes more. It becomes kapha vardhaka. Sorry, because it is explained similar to pamshudhane yata vrishtihi kledayat yati kardamam. So if there is a heap of ash and water is added or there is rain over it, what happens? The kleda increases in that particular place. Similarly, what happens if Yavagu is given in a Kapha Pradhana Jwara? It further increases Kapha. It is also said by Haritha sir that Milita Pitta Kafadhikeshu Purusheshu Yavagu Pratishedam Michanti. As I said, this whole explanation is about the different contraindications for the giving of patients with Peya, Yavago, and all that. But in between, there is one explanation. Paitiko va atha shitam madhuyutam pibet laja peyam. There comes the reference of when you can give laja peya. It is during this pitta pradhana, you can give the one with madhu. There is also one more contraindication for Yavagu. Kapha pitta paritasya urdhva asruk pittinaha tatha madhyanityasya na hita Yavagu. Again, there is one more contraindication saying that in urdhvaga rakta pitta, in madhyanitya, in kapha pitta pradhana patients, in among all these, Yavagu is not supposed to be given. Moving on, tatra tarpanam eva agre prayojyam laja saktubihi jwarapahaihi phalarasairuktam sa madhusharkaram. So one has to do tarpana. One can go with addition of phalarasa, jwarahara phalarasa. If someone asks to have a juice, what is to be given here is tarpana added with that. So what can be the drugs, what can be the fruits which can be used? It can be a draksha, it can be a dadima, it can be a kharjura, priyala, saparushaka, laja saktu, and with jwarahara phala one can give in conditions for tarpana to get. Moving on, then comes the point of what to be given next. Then Satmya Balapekshi Bhojayet Jirna Tarpanam. Once this Tarpana Dravya Jirnata happens, then one can go with Mudgayusha or one can go with Jangala Rasa. If the person is a bit Durbala, if his Agni is also a bit Durbala, one can plan for Mudgayusha. Whereas if the person is Balavan, one can go with Jangala Rasa. Annakaleshu chapyasmai vidheyam dantadhavanam. So before taking this particular foot, one has to do dantadhavana. So what are the features of this dantadhavana? It is mukha vaishadhyakara. It is prakanksha cha annapanayoho. So when one does brushing properly, it brings about akanksha. It brings about liking to have food. Dhatte rasa visheshanam abhignatvam karoti yat. So based on the rasa pradhanata, one has to select the proper vishodhya druma shakha grairasyam prakshalya chasakrat. Prakshalya can consider it as washing the mouth, similar to gargling. So what has to be given after the dantadhavana? Mastu ikshurasa madhyadhyaihi yathaharam avapnuyat. So once the person is done with uh, the previous digestion of the previously administered, he has to do Dantadhavana now and then go with other things such as Dadhimastu, Ikshurasa, Madhya, and others. Moving on, Pachanam Shamaniyam Va Kashayam Payed Bishat Jwaritam Shadeheti Shadehe Atite. So once Atita, once the Navajwara phase is over, Lagvanam, Pratibhojanam, Pachana Shamaniya Kashaya, all these can be given. Remember, until this phase, all these are not indicated. So, Jivita, shall we continue tomorrow?
Sir,
Shall we continue
hello.
tomorrow?
Sir, actually, in that previous case, after eighth day, we should give like all those kashaya and tikta ahara. But here, sixth day, they are mentioning so. Uh,
No, I do agree for that, but there is not much difference of days here, right? There is only one day because we get reference of Saptahat or Ashtame Ratre, right? We get two different references, or after 7 days. They both mean
then
the
what is the significance that referring that in that shloka kale means ashtaha only, and then again they are referring here 6 days. Then what is the significance of that?
yeah. Shadahe Atite here means Atite means is over.
Okay, sir.
There is only 1 day difference, that is 7 and 8. Many places we get this reference of Ashtame, that is eighth day, or Saptaha over. That means to say 7 days is over. But here in between we also find this Shadahe, that means to say after completion of 6 days. There's a very small difference in this, I do agree, but they literally go hand in hand. They almost, there's a 1 day difference, I do agree, but we have to consider in general as together this.
It means the Navajvara is like up the Kala of Navajvara to be like 6 to 8 days, like up till 6 or up till 8 days we should consider, na sir?
Better to consider it as 8 days because most of the references find is 8 days, not 6 days.
Okay, sir. Thank you, sir.
Yeah, yeah. We also came that we also had this reference of 8 days even in the Santata Jwara, the Vishama Jwara context also, right?
Sir.
Yeah, that is the one which is commonly said. As I said, Ashtame Dine or after 7 days. They both mean the
Okay.
same, right? Eighth
Okay,
day
sir.
after 7 days, they both mean the same. When we write history, also we write when you get when you get a case of acute stage. So patient has maybe severe low back pain, day 4 since 3 days. Today is the fourth day. They both mean the same. It is like that.
Thank you, sir.
Okay. So Jevita, shall we continue tomorrow?
Yes, sir.
Can you please the recording?
Uh, just a minute, sir.